Hello everybody, my name is Dr. Zak, and what I'd like to do today is speak to you about dentures. The two different types of denture, fully removable denture and an implant retained overdenture. So without further ado, let's get started. There's two types of denture, which is a fully removable denture, which looks something like this. So this is a maxillary denture, and this is a mandibular denture, also known as the lower denture. Upper denture, lower denture. Okay. What is the advantage of a fully removable denture over an implant retained overdenture? The main advantage is cost. It's substantially cheaper, obviously, to do just a regular denture than to place a few implants and put the denture over implants. The second advantage is, obviously, you generally will not require surgery to make this denture. All you do is you take an impression and go through steps of biting and border molding, and once everything is fine and everything fits well and the teeth are in the right place, the laboratory fabricates a final denture and we insert it. This has been used in dentistry for many, many years, works fairly well, but it's a far cry from the comfort and the function that you get from an implant retained overdenture. Let me go over the implant retained overdenture. So an implant overdenture is generally placed over a minimum of 2 implants, sometimes 4 implants. Okay, the more implants that are placed, the better. The denture internally will have locators that are inserted onto the implant. And once they're inserted, they essentially snap in and the denture will hold in absolutely perfectly. Sometimes it's very difficult to actually remove the denture from your mouth. So the chewing of different foods, such as steak or biting into apples or shearing different kind of foods that's difficult to shear with a regular denture, becomes a breeze. So the quality of life is just increases by tenfold as far as functionality, as far as being able to eat, as far as being able to do everything almost like you have your own teeth in place. The second big advantage is the overdenture over implants, especially if you have it on the upper and you put 4 implants, it's going to be less bulky. So if you make a regular denture, this is what it will look like, okay? And it will cover the palate. The overdenture over implant will look more like this. So the palate will be more open. Thus, your taste buds aren't as affected, your tongue is not bothered, and it's a lot easier to chew and feels a lot more natural and a lot less plasticky, much easier to get used to. And the last advantage and overall advantage that nobody actually talks about is once we place the implants in the mouth, the implant functions as a ridge preservation mechanism. So what happens when people lose their teeth, because there's no teeth in place, the jawbone will quickly recede. And that's why if somebody had a denture, let's say done about 15 years ago, they were doing pretty well with that denture then, but in the 15 years that they didn't have any teeth, the dentures receded much faster than it would have receded if the teeth were there. So when people come in 15 years later to do a second set of dentures, say, well, listen, we had this denture done 15 years ago and it was absolutely great, and now it seems like it's more loose. And the main reason why that is because there's a lot less ridge to hang on to. So what an implant does when we place it into the bone is one of the things that the implant will do very well is it'll preserve the ridge, and the bone will not recede as quickly with the implant that's in place as it would without anything there. Not only as quickly, but it will recede extremely slowly, essentially at the rate that it recedes when there's natural teeth in the mouth. So that is a very, very large advantage, what we call in dentistry bone preservation. Okay, so these are all the different comparisons between an overdenture and a regular denture. If you have any questions, please don't hesitate to call us or ask us. My name is Dr. Zak of Dr. Zak Dental and Orthodontics. Nice talking to you today.